How's everyone? She doesn't want to, she thinks her window. Her sister was downtown.
I think they'll have to sort that out before they come here.
Yeah. But she doesn't want the other sister. She doesn't want it. She's seems like she's the boss. It's a lot of fun.
So we side right there.
Hey,
I'll have to meet them again before you decide.
let Keith make it for a while.
Sorry, clicker? The door? Yeah. No, I couldn't find it, that's one.
Totally, yeah. Yeah, it's ridiculous. They shouldn't have it under control anyway, huh? Oh, yeah, you're right. Check all over the place. saw a little coffee shop there. My brother and I, yeah. It's really sad. Well, you can't because it's just sitting at will. It's so crazy. No one decided that. Not really, right, the one there, right. These guys will, they think they can do over that. You can't make it but it shows that the difference, right? Right, yeah.
Cold weather drives everybody in. You see what it's gonna be? It's gonna be 1 degree on Saturday morning.
It's happening, yeah, that's really crazy.
So I think we can get started. A good mix of business folks here. So if you'd like to get started, why don't you introduce yourself and your company and what you'll be speaking about today?
Sure. So good evening, everyone. So my name is Richard Taylor. I'm the Associate Director of Marketing for Metro Plus. And I have some people with me, some staff members from Metro Plus. So we have Michelle Sten over here. She's our Community Relations Coordinator. And she goes out to the community, meet with elected officials, etc., to make sure that Metro Plus is branded and has a presence. And then over to my right, I have Gilda Gillum. She handles our events, and she's our events specialist. And hopefully what we'll take away today, I've done this many times, and I like to leave it formal but also informal so that when we walk away, you can use Metro Plus as a resource and also hopefully provide you with some information that will help you in terms of your businesses as well as your employees. But we'll cover just the background of Metro Plus, some product information. We'll talk about the network in terms of, as well as the rates, Metro Plus care management programs, as well as any questions and answers that you'll have afterwards. First, how many people heard of Metro Plus? All right, so we actually do events, and then last year we were at Circle of Sisters, and of course they put us right across from Metro PCS. And so most people, they'll say, instead of Metro Plus, they'll say Metro PCS. Two different things, cell phone, health coverage, so just an FYI. But we're an HMO, Health Maintenance Organization. What that means, of course, is you stay within the network. We have physicians as well as hospitals that participate in our network. And the plan is based on an HMO concept where you get a primary care doctor and you stay within a network of doctors that are contracted with us. We're a wholly owned subsidiary of the Health and Hospital Corporation. So all the public hospitals, again, Health and Hospital is the largest publicly held hospital system in the United States, and that's run by Dr. Roche. Started in 1985, we're currently in all of the boroughs. Just officially, January of 2016, we were officially in Staten Island. So we have representatives set up right on the New York side. Excuse me, New York side. I also have Staten Island as they succeeded from the boroughs. But we're on the Whitehall side by the ferry in Manhattan, and then we're also stationed on the Staten Island side. So people get on the ferry and they get off the ferry and they see the presence of Metro Plus again for the first time. We have close to 500,000 members. Our goal for the year 2020 is to get to 1 million members. So the expansion of Staten Island, as well as the addition of the physicians, as well as the staff that has grown, we hopefully will get to that number. We offer 9 lines of business, again, from Medicaid to Medicare. Medicare, again, is for those in terms of a certain income level. And then on the Medicare side is for those individuals who are over the age of 65 plus. Also those under the age of 65 who have a disability. We offer Child Health Plus products, so there should be no child walking around in New York City under the age of 19 that doesn't have health coverage, because the premium for that is very inexpensive. So no one should walk around and say, I don't have coverage for my child. And then we have a managed long-term care program, Metro Plus FIDA program, which is a fully integrated dual advantage program. This is a program that combines Medicare as well as managed long-term care products together. And then we have a HIV SNP program, Metro Plus Gold, which is just expanded. That used to be offered only to the Health and Hospital Corporation, but now is offered to all city employees. That just came into fruition as well. And then, of course, Metro Plus Marketplace plans, which is pretty much the Affordable Care Act, the Obamacare plans. And then we have our SHOP, which is for small businesses, which I'll touch on with you guys today so that you can get a feel of what's going on. And then we have close to over 28,000 providers, as well as over 20 hospitals in our network. So what is SHOP? It's really just small business health option programs. There's two sides to the marketplace. Everyone's familiar with the marketplace? So the marketplace, and I see some looks. So let me just give you a Obamacare 101, because it is kind of confusing. Most individuals with the Affordable Care Act, which started about 4 years ago, the concept was to get people to have health insurance. So you have two sides to it. You have the individual side for those people that are not covered under the employers, and then you have the side for the small business groups. Last year, in 2015, a small business was considered anywhere from 2 to 50 lives, 2 to 50 employees. In 2016, they raised that to from 1 to 100 lives. So they increased the size of small groups. What does that mean to small groups or small business employers? It's tough, because we know that in order for you to offer health coverage to your employees, it's not a burden, but it impacts your overall overhead. So somebody has to take the weight, and it's pretty expensive to have health care coverage. So the Affordable Care Act put into place an opportunity for small business to offer health coverage to their employees, and for doing that, if you offer it, then you get a tax break, you get a tax benefit. You would speak to your tax account based on the benefit that you have. And I'll go into that a little bit more. On the individual side, those are just individuals who do not have coverage, that can just walk out and see one of our representatives, go into a facility, see a navigator, people that assist them enrolling, and they enroll into the plan. Now, it's mandated, so some individuals will think, well, you know, I don't have health coverage, I don't have to get it. Well, the way the government, or the federal government, they get you is that when you file your taxes, there's a penalty. So for 2016, for individuals who do not have health care coverage, it's $695. 3 years ago, it was only $95 per person. They went up to $695 because, again, they're forcing individuals to join a health plan. But there's some advantages when you join a plan, and I'll talk to you about some of those advantages as well. So for small businesses, 1 to 100 eligible lives, this is who can enroll into the plan. You have to have a primary business address in New York. You have to enroll at least one common law employee. So my background prior to coming into Metro Plus is I was on the broker side. I used to broker as well. And one of the things small businesses did, you had a husband and wife, and then they would try to get health insurance. But the common law rule is that if you want to have if you want to enroll into plan, you have to have one employee that's not your spouse, or that person cannot be a partner. So it has to be a common law individual. So if there's 4 people that work for you, it can't be the husband and wife that says, I want to cover my wife, so can I get health insurance in the small business? No, you can't, because then they'll look at you as a sole proprietor, and then you have to go out on the individual side to both get insurance. But if you have, again, 3 employees, and that person is not a partner, and is not your significant other, then you can enroll that person. You can offer health care coverage to everyone in the group. You have to offer health insurance coverage to all of your eligible employees. So you couldn't have a plan where all of a sudden John has 7 employees and 3 people are executives, and he says, you know what, the executives will take health coverage, and with the rest of my staff, I'm not offering anything, but you don't have to cover my executive. Everyone has to, you have to offer health coverage to everyone in the plan. The other thing is, qualifying for the small business tax credit. Again, this is something you can talk to your accountant about, but the purpose for offering the health care coverage is if you cover 50% of the cost of health care coverage for workers based on the single rate. So it's not a family rate. So in other words, if your rate is $300 a month for a single person, and then it could be $1,000 for a family, you're not going to cover the $1,000 rate. You're only saying, I'm covering the single rate, and the additional $700 that needs to be paid, that's on your staff, that's on the employee. What you're responsible for covering is the single rate. Does the small employer have 25 or less full-time employees? And does the small employer pay an average annual wage below $50,000? If you have these qualifying events, then you qualify for a tax advantage, and you would speak to your accountant based on that. So there's various levels of coverage. So with the qualified health plans, or Affordable Care Act, better known as Obamacare, they have various levels. So you have the bronze level, a silver level, a gold level, and a platinum level. And just like the metals themselves, the lower levels have a lower rate in terms of what the reimbursement is. So the plans will pay 60, they call it actuarial fees. The plans will pay 60% of the care, and then you're responsible for 40% of the care. And as you go up to the silver level, the same thing happens. It's 70% of care. Gold level, the plan pays 80%, and then platinum, the plan pays 90% of care. Of course, in terms of the cost of the plan, the lower the metal level, the lower the rate for the plan, because there are deductibles and co-insurances and co-payments involved. And as you get higher into the platinum level, there's less out-of-pocket expenses, and you pay more for the coverage. And this is just showing you how we named our plans. Our creative marketing team, they got together and said, what should we call these plans? And they decided to go with Bronze Plus, Silver Plus, Gold Plus, and Platinum Plus. So those are just some of the plans. Now, one of the things the health plan did, or the Affordable Care Act did, is they allowed certain things to happen. So I don't know if you're aware of it. So I've been in the industry for about 28 years. And one of the biggest things about the industry was there was differences between what someone paid versus what someone else paid. So one of the things they've done away with is there's no discrimination against age, disability, or sex. There's no cost in terms of if you're in the hospital in the past, if you had $1 million coverage, you stopped at $1 million and the hospital would say, what do we want to do? Who's going to pay the rest? But now it's unlimited. So in other words, while you're in the hospital, you're cared for regardless of what the cost is. There's no pre-existing conditions. So in the past, if you had any type of diabetes or pre-existing and you tried to get insurance, the insurance companies would say, you know what, we're taking on a risk. You had a 6-month waiting period before. So in other words, 6 months, if you had any condition, you had to wait that 6 months before the company would pay for your coverage. Now there are no pre-existings when you roll into a plan. It starts on day one, you're covered at 100%. So these are some of the things that have been taken into account. The other thing the Essential Plan did is they cover all of these things. They cover 10 essential benefits. The Affordable Care Act made everyone play on a level playing field. So any plan that's offered has to offer these 10 things. All plans. And some plans, and you might have heard, and I don't want to get into the politics of it, but a couple of years ago, you heard about people who had health care coverage, and they said, oh, this plan is not great, I had to lose my coverage. Well, you have to have something that's called credible insurance. And the easiest way I can explain that is in car insurance. So if your car is worth $50,000 and you have $40,000 worth of insurance, you're not covering your car. So the same thing with health insurance. If someone says that, well, I'm only paying $200 a month premium and this is the best thing, but if you're hospitalized with what you had in the past, you didn't have enough coverage because, again, you might have had a limitation on what you're being covered, and then the hospital will say you don't have enough money based on what your assessments or your diagnosis is. So everyone's on a level playing field. You covered rehab services, maternity, emergencies coverages, prescription drugs, preventive and wellness, pediatric service, ambulatory care, hospitalization, mental health. So all these things are covered in our plans. These are some of the facilities that we have on board. I don't have Staten Island here, which I forgot. So we have Seaview and Staten Island. But these are some of the hospitals that are on board with Metro Plus. So, in the Bronx, we have Montefiore, Lincoln, Jacoby, Manhattan, Bellevue, Harlem Hospital, Metropolitan, New York, Ioneer, St. Luke's, Beth Israel, Queens, we have Elmhurst, Jamaica, Flushing. This is our website. Again, if you want additional information, go to metroplus.org. And then the most important thing, some of the care management programs that we have, because again, the whole concept of HMO is preventive care, preventive medicine. So some of the things that we do in terms of our care management program. Turn to the next one. So we have Asthma Plus. Again, these are where they provide case managers to assist individuals whose child or whomever has some of these ailments. So with Asthma Plus, you get a case manager to make sure that the physicians you're seeing, the medication you're getting, so they're coordinating your care to make sure that things are expedited and you're getting the best of care. Same thing for diabetes. We have Metro Plus Medicare for individuals, case managers assigned to seniors so they can help them navigate through some of the difficulties they may have otherwise. Metro Mom, again, for our pregnant mothers, behavioral health, Complex case management, when somebody has healthy heart and diabetes, you know, there's some comorbidities that, of course, when somebody has diabetes, it's not like they passed away or passed from diabetes, they passed away from heart complications as well. Domestic violence, again, smoking cessation, and supplemental security income. So these are just some of the case managers that we surround individuals with. Wanted to provide you guys some information regarding some network classification and rates. One of the things we find is that when somebody enrolls, we have about 870 individuals in our shop, employers in our shop program, members. And what we found is that when somebody enrolls in the plan, then they have a primary address here, and then all of a sudden they're using services in Connecticut, or they move to California, they're trying to use Metro Plus. And that, you have to stay within the network that we have, which is based out of the 5 boroughs. And so we found that a lot of people were going out of network. They joined and they lived in New Jersey. They were going to see doctors in New Jersey who are not in our network. And what happens is they'll get a cost for since they went out of network. And what we had to do is explain that because it's an HMO, you have to stay within our network. And if you live in New Jersey, then you will need to join a plan that's based out of New Jersey. So we just wanted to make sure that in network, the individual can obtain urgent care from a participating physician or participating urgent care. And the key word is participating, because everything is in network. We do not cover out of network. But again, if you have an emergency, just like any plan, so if I'm anywhere and I need an emergency, I can go to any emergency room. But I can't just go to an urgent care center out of the network. But I can go to any emergency room because it's an emergency. Okay, we can go next. Go to the next one. You go to this one. Let's go. These are just, you're not going to see all of these, but these are just some of the rates for Q1. One of the things about rates on the small employer side, rates are based off of each quarter, so the rates change quarterly. So these are the rates up through March, and then Q2, there are different rates, Q3. The rates vary, and they don't change much because the fact that we're part of the marketplace, the state doesn't allow us to have increases normally when you go outside of the marketplace. When you're outside of the marketplace, the rates can go anywhere from, they can go up to 18%. But because we're part of the marketplace, our rates go up, if anything, 5%. And 2000 to 2016, 2015 to 2016, our rate went up about 5%, which is great in the insurance industry. All right, and these are just some terms that you may know in terms of co-insurance, is what your share of the cost is. Deductibles, again, the amounts you have to contribute, and premium amounts, as well as out-of-pocket limit. One of the things that I told you that I wanted to discuss is, the reason I'm here is to let you know some of the things we found out when we're speaking to small employer groups. Number one, the fact that, how many people have, I don't know, under 20 employees? Anyone 20 employees? Okay. How many people have like 2 or 3 employees? Anyone with small staff? All right. So one of the challenges with the small groups is when you offer insurance to your employees, it's always a great thing because then you'll have a loyal employee. Right? The employee's like, wow, I'm being offered health care coverage. My employer is paying a certain percentage. So if the rate is $300 and the employer says, you know what, I'll pay half of that. I'll pay $150 a month for you. And you do the math over the course of the year. 150 times 10 is $1,500. So, you can do the math. And so it's a benefit to the employee because they're like, wow, my employer is invested in me. I have coverage. But for the small employer, we realize there's a challenge with the overheads and the other things you have to do. So that's the challenge. Once you see what the bill may come to every month, then you may say, you know what, I would love to do this, but I don't know if I can afford to do it. So what we can offer you is this. Number one is we have representatives that can present to you and your staff and provide you a one-on-one consult and do a presentation and sit down with you where you can say, you know what, this is something I'd like to do. The other thing, even if you can't do it for your employees, the other side is, you know what, I can't afford this year. But we find that employees who make a certain income, they have a certain income level, you may not cover them as an employer, but what you can offer them, say, you know what, I can't cover you. But what you can do, Metro Plus is come in here and sign my employees up on the individual side. And we have plans that can cover them individual, where you, the employer, do not have to come out of your pocket, but what happens, the employee then pays for the coverage, okay? There's no tax advantage for you. But what you can do is say to the employee, you know what, you go on the individual side And if your bill is, I don't know, $150 a month, I'll cover you $100. You know, I'll give you a stipend for $100, and that may cover you. What we also find is that because of the various tax advantages that the individual plan offers, sometimes employees do not pay anything. They qualify for Medicaid, they qualify for a subsidy from the state, and therefore it costs them $60 a month. So the option for small businesses is to be informed, to let your employees know, like, I can't cover you, but you're supposed to have healthcare coverage. Why don't I bring somebody in here to have this discussion with you? And all we do is we put the information into the system. We ask them, how much do you make? They say, I make $25,000 a year. We put it into the system. The state, the government knows how much money you make because you filed your taxes. And as long as your income is within a 10% range of what you told us, you don't even have to show us your W-2. If it's within the range, we put the information in the system. The plan spits out to say you qualify for these plans as well as for tax subsidies based on your income. The income range is based on a government, what they call a federal poverty level that goes from 100% of the federal poverty level to 400%. What that equates to in dollars, it's like a single individual with no kids or anything making $15,000 up to about $23,000 and change. That's the range. Now, there's a new plan that's been offered in January of 2016. It's an essential plan. It started in November, but individuals became effective 2016. It's an essential plan. It's new. It's the hottest. It's the latest. It's the sexiest plan that's being offered. I don't know if you can say sexy with insurance, but it's the sexiest plan being offered. And what's being offered is for $20 each month, a $20 a month cost. They're covering those individuals. When they came up with the Affordable Care Plan, they left out those individuals what they call a family health plan. These were adults, okay, adults over the age of 19 who fell off when the Affordable Care Act came up. They qualified for Medicaid, but they fell off, and the government missed these individuals, and they had to come out of pocket to pay for their plans. Now the government's reduced the plans. They offer them this essential plan, and if you make an income of anywhere from $15,000 up to $23,000, and you're a young adult, that's all it costs you. It costs you $20 each month. So what's that? 20 times 10, $240 a year for health coverage that covers you based on all those 10 essential benefits. All right? I'm going to wind down now, but what I wanted to make sure that I leave you with is I have my cards. I just wanted to make sure you guys had the information, and also you can reach out to us. In your packets, you have all the information as well as business cards. Give us a call so that we can sit down with you and answer any questions, all right? Any questions before I go? Any questions? Anyone's good? Thank you for your time.
Thank you.
My apologies. Thank you, John, for starting off the meeting. Keith Taylor, I'm the chair of Economic Development. And I want to thank you for your very informative presentation.
Thank you for inviting me as well.
And your contact information, if someone were to want to reach you on the website, I have it here, but just because we were going to put this on our website. What would be your web address or your web?
So
site?
in terms of Metro Plus?
For individuals who want to.
So they can just go to metroplus.org, and then from there they have, if they're in Manhattan, then they'll funnel it back to me.
Okay.
But our website is just metroplus.org.
We can send you an email with the full, I'll do that.
Thank you.
You have some stuff.
Thank you.
We'll be sure to spread the word.
Thank you very much. Appreciate it.
And Mary, are you ready to present now, or do you want to? It's up to you.
I need to set up.
Okay, so then we'll go on with the applications.
Okay, we're going to do our SLA applications. Is there anyone here from Sylvia's Restaurant?
Yes.
How you doing?
Hi, how are you?
Good, thanks. Why don't you step up here and tell us a little bit about what's going on. I'm John Lynch. And you are?
I'm Kenneth Wood, President and CEO of Sylvia's Restaurants. We was incorporated. Second generation owner. Sylvia and was my mom. President Sylvia started the business in 1962. we're just here to renew our license. This is we've been renewing about over 30 years now.
I mean, we just want to know that you're violent.
Okay, well, I thought you would put me on the spot. Yeah, so that's basically it.
So, how things go? How
Things are going well.
There's a lot of competition in the restaurant business.
Oh, yeah,
in your neck of the woods.
but it's good competition. You know, always, even before my mom passed, she always taught us, say, you know, don't worry about what the next person is doing. Make sure you're doing what you're supposed to do. You know, and that's a philosophy that the family, you know, have lived with, and we've been blessed with that. You know, so the competition, I always knew. We've been in business now. In August will be 54 years. So we have seen many decades of changes here in Harlem. Many. 60s, 70s, 80s, 90s, and in the millennium. So I always knew that Manhattan is an island, and eventually downtown was going to make it uptown. So, and it's a resurgence, because I think in the 50s, I was born in 53, I remember running around here as a little boy when there was much commerce here. And I know you know that, Harlem. So I've seen Harlem boom, and then I've seen it go down, and I've seen it come back again. So I just hope that the neighborhood has rich culture. And this, you know, new wave, I just certainly hope that we don't lose some of its essence too, that richness of it. And we plan to be here. You know, we keep it real. You know, we stay who we are. We evolve as a business. We stay true to who we are.
Okay. Any questions from the community? Carol?
Have you started your renovation?
No, we've had several delays on the renovation. We was prior to 2008, we was getting ready to do a renovation. Then when the crash happened, because we've been blessed to have invested in all our real estate. So, and sometime, you know, I said this publicly, I said it privately too. It's a great thing that we have our real estate, but sometimes what's good for the real estate is not good for the restaurant, and what's good for the restaurant is not good for the real estate. So, but we're definitely getting ready to you know, make that happen over the next few months, and we'll keep y'all informed as it progress. And we have something really nice coming up, hopefully.
I believe the young lady's your daughter that was here last night.